Back Soon is a program out of Connections Early Years Family Center in Windsor, Ontario, Canada. And it is a short-term childcare program for children 0 to 6 years of age for parents who are living with low income. It allows parents to attend appointments for medical reasons, social service, employment, education purposes. While we care for their children, the child is placed in a stimulating environment where they are safe and healthy, and the parent can attend the appointment without worry. It's available for 2.5-hour periods throughout the week. And many of the people who use the program are newcomers to Canada, women who are looking for employment, who are marginalized or racialized in our communities. The key features of this program are that we use qualified staff who understand child development. They're registered early childhood educators. Another key feature is that it's free. It is flexible in that we try to meet the needs of the family. When the family has an appointment, we try to be responsive to support them during that time. So since the pandemic began, we were suddenly faced with program closure. For many of our other programs, we were able to flip to virtual. For the Be Back Soon program, that was a little bit different because the unique feature was for the child to come into the center to be cared for while the parent was away, so they're able to go attend appointments. We looked at how we could continue to stay in contact with the families that were registered in the program, and we added phone calls. We were doing some health checks, mental health checks, not formal ones, but certainly just checking in with the families to see if they needed anything that we could offer them in terms of support, or offer them some referral to an agency that could help them. We then extended ourselves to virtual meetings. We would reach out to them and offer some songs and stories and some engagement opportunities. And then it extended to packages. If families were, short on perhaps some activities for their children, we were putting together some to-go packages, and they would just need to come by and pick them up. Or there was some delivery involved as well. Once the pandemic was moving on after the first couple of months, we looked at reopening. We knew that it was vital that these children were cared for while parents attended appointments, and everything was starting to reopen again. We were able to open up with the help of our public health unit, who helped us set up our health and safety guidelines. And we started seeing families. I would say the challenges for implementing the program during the pandemic were often around the health and safety measures. So there was a lot more cleaning, a lot more disinfecting, a lot more conversations pre-visit. So we were calling families not only to register them for when they needed it, to gather the information for the child, but also to ensure that they had done their pre-screening, which was a requirement before they came to the building. And then when the vaccinations started to come out, our funder reached out to us and asked if we would offer the service as it is, but also specifically for families who live in particular postal code areas that were identified as lower rates of vaccination in those neighborhoods. They were often newcomer neighborhoods, lower income neighborhoods. And we partnered with our funder, who offered us additional funding if we needed it for staffing, with the local downtown Chamber of Commerce, the health unit, and we pulled together a promotion to say, if you need a vaccination and you need childcare, contact us. We will provide the childcare while you go get vaccinated, because at that time, young children were not allowed to go in to the vaccination center. After a couple of months of that, we were approached to then also offer a vaccination clinic at our center with the support of the Be Back Soon program. The pandemic, as we all know, was a bit challenging, but it did bring with it some advantages to enhancing our Be Back Soon program, because what it did was allowed us to expand who it was available to. The clients who attended our program pre-pandemic were families who qualified financially during the pandemic, and when we started beginning to support the vaccination drive, the opportunities for additional families opened up. And so any family who lived in target neighborhoods were able to access the program for vaccines and for other services. The goals of the program are to support families with low income. With the pandemic, the goals became a little bit harder to achieve for some families who were completely isolated, and for some children who very rarely saw other people, perhaps. So the goals became a little bit more finite, and they were still the same goals to help families achieve what it is they need to reach success. But it was also to help children establish a comfortable routine for leaving the home, for parents to feel safe leaving their children after perhaps 2 years of not leaving their children. One of the changes we did implement was that we became more flexible with our hours. We really wanted to be responsive to the families when they needed it. Before we were, it's available 5 days a week for 2.5-hour periods. Whereas during the pandemic, we just felt like the need was so much greater that we said we're available 24/7 if we can accommodate it. Some great things came out of the pandemic in terms of service delivery. So we're going to continue to be flexible with our times that are available. And there's a place to continue to connect with families, not just when they come in person, but by phone and virtually. If we haven't heard from them in a week, in a month, because they are registered with us, there's no reason why we can't say, hi, how's it going? So it will become a blend. The pandemic was an opportunity to engage. It also enhanced our partnerships with other community partners who perhaps we may not have been engaged with previous to this. We're going to continue with connecting with community agencies. One of the needs pre-pandemic is to connect with those agencies who are trying to provide housing. If we connect with them, if we provide the family with childcare while they go look at housing, they can do it now. But I think formalizing the partnerships in the future is something I really want to commit to.
Our funders do actually have the template. We calculate how many families we have, how many unique families, and then how many ongoing families. For example, there was 448 unique adults, 364 unique children, and then ongoing, there was 404 for the year of 2020. How we get our quality measurements is through feedback from parents, verbally after they have had their Be Back Soon visits. And then also we do every 6 months, we do an evaluation with them. And it just has different questions like how the program is working for them, is it meeting their needs, how they heard about the program, how often did they use the program, what purposes did they use the Be Back Soon program for? Has the Be Back Soon program help support your family financially? Is it helpful for them? What could we maybe do differently that would support them in a better fashion? So some of the quality features for the parents who use the Be Back Soon program, what they have mentioned is it's very helpful for them to go to their job interviews. It's very helpful for their doctor's appointments. Some of our parents are actually going for their driver's license tests. One of the examples I can give, we had a mom who actually went to the vaccine clinic found out she was unable to bring her daughter to the clinic. So luckily the clinic knew about the Be Back Soon program. So they had mom call the center. We could accommodate mom bringing the little one to the center. And then she got to go back and do her vaccines. The families used the Be Back Soon program for the vaccine clinics a fair amount of times. And also for doctor's appointments, because at this time, many doctor's offices did not allow children to come with the adults. We had a mom also who actually used Be Back Soon program for job interviews. And eventually she actually got hired on and her daughter went off to daycare. And she also spoke about how the transition for her daughter to be able to go into daycare, how much easier it was, what a better result for her daughter because she was used to being in childcare. We had a mom who was trying really hard to get the rest of her family over to Canada. She had lots of legal appointments and lots of paperwork to fill out, stuff like that, but she had two little ones here and she was here all by herself. She used the Be Back Soon to successfully bring the rest of her family over to Canada. One of the most important things about our Be Back Soon program is supporting the families, but most importantly is watching the children when they leave, the smiles on their faces, and then hearing that they want to return and come back to play.
Right before our pandemic, we actually were successful in receiving federal dollars to run this type of program in different communities across Ontario. So one here, one in downtown Toronto, one in Eastern Ontario, and I think one up north. And it was to really do a research around, is it viable? And so we started running the programs in October of 2019. And in March, literally, as the world was shutting down, the program ended. And we did a research paper on it. And what it proved is that there were many, many marginalized and racialized women who used our program across Ontario just to be able to have a stable family life. They needed it. If it wasn't there, they weren't able to sometimes get those necessary pieces, whether that was a doctor's appointment, a dentist appointment, or a job interview, whatever the case may be. The advice I would give to people who would want to replicate this program is first and foremost, they need to have qualified staff in place. They need to have those staff that understand child development, who understand trauma, who know how to deal with children who are having a difficult time, as well as with parents. They need to know how to support parents. If someone was looking to replicate this program, I would also encourage them to form partnerships with community members. We had partnership with a taxi company, first of all, and then of course, our downtown BIA then took on the role of covering the transportation for families. During the pandemic, our partnerships with our health professionals was significant. They guided us in what was a good health and safety practice. Another consideration for replication of this program is you want to make sure that your hours of operation align with where the families are going. Because when we work with families, it's not 9 to 5. It's, we need to have staff who know that sometimes you're needed on the weekend, sometimes you're needed a Sunday morning or an early evening. So flexible staffing. And then of course, the last one is always remember those children when they come in, they may be so excited to access this program, but given our last 2 years, they may also be traumatized or just absolutely anxious about being left without their parent. So those are serious considerations before replicating the program. somebody once asked me if there's training provided. And I could happily offer anyone some training because we've done this for so long. We have some great materials that are provided. It's not a complex program. That's the beauty of it. It's so effective, and it's simple to run. You just need the basics, but they need to be there. It's not an option.